Thanks, Kelly. So hello, everyone. Thank you for joining us today. My name is Joe Pedinti. I'm currently the Director for Digital Health Advisory Services here at Health Excel. Before we begin, a quick note on the dynamics of the meeting today. We will be chatting with Russell, the CEO of Headspace, about business models in digital health firms and mental health, followed by a Q&A. As we progress through the discussion, we would like to encourage our audience to post questions using the Q&A button at the bottom. Mental health, I think, has been seeing increasing interest and investments in the last few years, leading to a crowded and competitive space. It's definitely getting harder for solutions to differentiate, stand out from competitors. In today's chat, we'll talk about business models that have worked so far and what we can learn from industry leaders like Headspace Health. To answer all these important questions, I'm excited to be in conversation today with Russell Glass. Russell is the CEO at Headspace Health, the world's most comprehensive and accessible mental health care platform. Headspace Health was created last year in 2021 through merger of Headspace and Ginger, two leaders in mental health, and has touched the lives of over 100 million people in 190 countries. Russell, thank you so much for joining us today. To get us started, it will be great to hear from you about the merger between Ginger and Headspace. It almost seems like a perfect merger between B2B2C and B2C2B models. So why did the merger make sense, and what can others learn from it?
Yeah, well, first of all, thanks so much for having me. It's great to be here to talk about this. Obviously, a topic that is near and dear to my heart. If you look at Ginger pre-merger, we were focused on on-demand mental health, very, very specifically in the B2B world. So we were supporting, hundreds of enterprises and a number of health plans like Kaiser Permanente and Cigna. And on the Headspace side, they had built really just this beloved platform for engaging people earlier in their mental health journey and helping them build a mindfulness and meditation practice, helping them, what we call sort of brush their brain, right? We don't brush our teeth because we have tooth problems today. We brush our teeth because we're trying to prevent tooth problems. Same with meditation and mindfulness, the incredible body of evidence that shows how effective it is at preventing downstream issues. And as we were each growing, we realized that, we were missing something on both sides. On the Ginger side, we were taking care of people once they had more of a need and providing on-demand coaching, therapy, psychiatry based on their level of need. Trying to figure out how do we solve the supply-demand imbalance that exists in mental health, where 60% of the diagnosed population isn't getting care.
Yeah.
But we recognize that we're never going to fully tackle that problem if we don't have a robust prevention capability and start way earlier to keep people out of the system. On the other side, Headspace saw that they had this great engagement driver. People loved it, but at the moment of greatest need, when they actually needed more than prevention, they had to say goodbye. They didn't have anything for them. By bringing these two things together, we get the best of all worlds. We get a platform that's loved by millions to help prevent mental health issues. And then we have a platform like Ginger that can scale this step care model to get people to the right level of care. And when you bring these together, you have the most comprehensive, most accessible mental health platform in the world. And that's now what we're focused on, is how do we bring that to as many companies, as many health plans, and as many consumers as possible.
That's great. I can definitely see, like I said, I think it almost seems like the perfect merger, and now you definitely offer more comprehensive care. Given where we are post-pandemic, what do you think of the mergers, M&A activity happening in this space?
Well, I won't quite call pandemic over yet. I think there's still maybe late pandemic, I hope, but maybe not quite.
I think that's a better term. I agree.
But from our point of view, though, it's probably still mid mental health pandemic, right? I mean, what we see is when the pandemic hit, we had this incredible spike in mental health need, right? You have this incredible growth in acuity, about a doubling of the number of people who are presenting with clinical levels of anxiety and depression. And that has sort of leveled off, but it's stayed at that high level. And we don't see any near-term signs of that decreasing. So we are still very much in the middle of what I would call the sort of secondary effect of the pandemic from a mental health standpoint. And, the M&A activity, I think, is being driven from a few places. I think both ultimately positive for the industry, although it may create some pain for, companies that have been invested in the interim. There was an explosion, a proliferation of mental health solutions, right? So all these entrepreneurs saw the need. They saw companies like the Gingers of the world and the Headspaces of the world getting a bunch of funding, and they said, okay, I want to do something to help this societal problem, and rightly so, recognizing that the hundreds of billions of dollars of need out there, right, of scale out there. But it, like any industry, you can't have thousands of different vendors going after a problem. And so ultimately you need to consolidate. You need to have certain winners that are, consolidating. And it's for a whole bunch of reasons. A big one is buyers, right? So health plans and payers, I guess, health plans and enterprises, they can't manage dozens and dozens of different vendors, let alone hundreds or thousands. And so increasingly what we're seeing is buyers looking for comprehensive platforms, right? They want to solve the mental health need of their employees or of their members with fewer, more scaled, more proven platforms. And so that's one driver. Second driver is liquidity's dried up. So investment is harder to find. Companies that, like anybody who's an entrepreneur in the healthcare space knows, it ain't cheap to build a healthcare company, right? The regulatory science, et cetera, costs alone are expensive, let alone all the stuff you're doing to actually build a product. and so, as capital dries up, there's just a lot of companies that are going to be looking for, soft landings, and platforms where they can continue to expand their.
Yeah, I can definitely see that, right? I mean, there's definitely capital drying up. More and more startups are under pressure to commercialize, show profits and returns. And I think that also makes sense for niche players to probably join hands to kind of make a more comprehensive solution so it's more applicable, gets more revenue from health plans and all of that. So yeah, that's great. In Health Excel, we're definitely in our meetings and conversations with a lot of pharma companies, with a lot of mental health space solutions, and partnerships with pharma firms is definitely quite popular. Any possible challenges that you foresee for startups that are looking for partnerships with pharma in mental health?
Well, I mean, I think, obviously pharma represents a significant opportunity. The infrastructure that pharma has set up to reach consumers is very interesting. So, a lot of the success that we've seen, not just in mental health startups, but even more broadly in digital health startups, has come through either, the partnerships directly with pharma, or partnerships with the infrastructure, like the digital formularies, of the world, which have been incredibly impactful to some of these growth models. And there's a simple reason. It's built-in distribution, and it makes contracting super easy, which is always complicated when you have a startup that's trying to do business with a larger entity. And so I think the opportunities abound. The watch outs, are many, right? One is these contracts can take a lot of time. And so if you, as a startup, don't assume that the contract's going to take probably twice as long as you think, you could run into a wall, right? So that's one. It's just, I have never seen somebody say, wow, that was easy, when contracting with, a large pharma company or with a formulary or part of the infrastructure. Two is once the deal is done, it takes a long time to get revenue generating. So often it is, even downstream of the contract that you have to plan on, I won't name names here, but, we've got a few large health plan partnerships that are literally years, from signing, and we're just starting to see revenue ramp. And we've got people on it, they're full-time people on these deals, focused on driving revenue, but it just takes time. And it takes time because these companies are not structured to sell our stuff, or their sales team are not educated on our stuff. So each one of those steps to get into their channels takes a bunch of time. Now, once you have done that work, the upside is tremendous, right? Millions and millions of lives will have access to our products and services as we get it scaled, but it takes time. If you're a startup and you're resource limited, you have to pay attention to that, because it could take you 2x, 4x longer than you think to get to revenue. And that may make liquidity a huge issue for you if you're not planful about it.
So to your first point, contracting, I completely agree. I almost sometimes think that it's meme worthy to probably talk about how long paperwork will probably take. The second point, Russell, you talked about taking longer because challenges with sales teams and a few other challenges there. Anything that can help mental health solutions do that faster? Like, how do you educate sales teams better, for example? Or is there anything that they can do differently or learn from your partnerships?
Yeah. Well, I think, be focused on outcomes. So the world is moving rapidly to return on investment and outcomes measurement in this world. So, the sort of days of the Wild West here are rapidly ending. And, the requirements of being able to provably show that your solution is delivering positive outcomes is more and more important. Two is be as value-based as you possibly can in your business model.
Okay.
Because that is certainly the model of the future, right? If I oversimplify this, if you look at fee for service as being, an incentive that's entirely startup friendly, right?
Mm-hmm.
Or enterprise friendly in terms of delivering the service. And it's very simply, you get paid the more sessions you deliver. You're incentivized to deliver more care, right? At higher cost. As you move from fee for service to, let's say, some forms of capitation, let's say PMPM or PEPM, and all the way down to value-based, the incentive starts to shift, right? And the incentives then become, how do you deliver outcomes at lower cost? And I know I'm not, this is not entirely novel to people, but the point is that being able to get to outcomes at lower cost faster is going to be how you are able to accelerate these things, because you're taking the risk away from somebody contracting with you, right? You're taking the risk away from somebody that, may have never heard of you before, or only has a light understanding of what you're doing. And the more that companies can think about that from the beginning and, quote unquote, put their money where their mouths are, I think the faster they'll be able to move and scale their business models. And some of the fastest growth digital health companies in the world use this approach. If you look at Livongo, you look at Hinge Health, companies that have really scaled quickly have been able to do so through value-based reimbursement models.
Okay, one last question on that pharma partnerships. Is there a way to select the right partner when it comes to pharma and vice versa?
I always start with sort of cultural and values alignment. So, make sure that, first of all, you've got a strong connection and aligned values and what you're trying to accomplish. If you don't start there, it's hard to make anything else work. Then Second is, okay, what are the incentives, right? So business alignment in terms of what are they trying to accomplish?
Okay,
And are you having to force fit your model into what they're trying to accomplish? Or are you solidly aligned, right,
Got
with
it.
what they're trying to do? Because if you can be fully aligned, both in culture and values in business model, you're off to a really good start in terms of, a successful partnership there.
Okay, thank you. So getting into business models and probably talking about, say, B2C, Headspace, I think, is such a successful consumer brand. Could you talk to us a little bit about the value of a strong consumer brand in the mental health space?
One of the really important factors in the merger was that we were of the belief that if you're going to solve prevention in mental health, if you're going to get people thinking about mental health earlier, you need to have a strong brand,
Mhm.
right? It has to be something that can destigmatize and convince people that this is something they want to do. And that is such a critical piece of brand, right? Brand is something that helps people feel comfortable with your product or service. You have an authenticity of these millions of people who have used this and been successful with it, and that allows others to start to engage with it. So that's one reason for the brand. Two, though, also, again, from a business model standpoint, I often think in terms of flywheels.
Okay.
So how do you create flywheels that drive business value, right? And allow that business value to sort of self-perpetuate. Well, one of the really important pieces of a consumer capability is that as you're building a B2B business, right? So this is the B2C to B, right?
Mhm.
First of all, business people, employees are consumers. So the more of a ground up capability you have, where there are a number of people in an enterprise already using your product or service, the easier it is to sell into the enterprise, because there's an awareness, there's a desire already to access the product. But two is, once you're in, engagement is much higher because of the brand. And that flywheel is very powerful. So we come into an enterprise without working very hard. We have 30% of sign-up rates because of the brand.
Yeah.
That drives that starts to kick off a flywheel both internally. So we now have more and more data about the employees that we can use to make sure they're getting access to the right services.
Absolutely.
Right. But then all of those people who are using it at the enterprise are consumers.
Yeah.
And they then can start to refer other consumers to this great product, Headspace. They can gift Headspace. They can start talking about Headspace, and that drives the consumer cycle. Those kinds of flywheels are super powerful. The trick, though, is consumer brands are really hard to build, and they're expensive to build. And so, that's one of the reasons we said, rather than try to build Ginger into a consumer brand, it makes more sense for us to bring this together with a powerful consumer brand and use that to generate the flywheel.
I think you make a good point about using data that's coming off of, consumers and building that into the flywheel. So D2C, I think, is a popular route in the market, but it also may work better for, say, meditation or telemental health. And also consumers, I think we're seeing expect their healthcare more and more to be covered either by insurance or employers. So would companies that are then focusing on the consumer eventually for revenue or other purposes, is the focus on consumer just a route into getting into B2B business?
Well, I mean, I will say that as we look at our business, the B2B, the B2B sort of payer side of the business, the employers and the health plans are absolutely a more scalable sort of long-term value business. I think that those distribution channels are much more cost effective. They're much more sticky than your consumer business tends to be. So I expect that the majority today not quite 50-50. We're probably closer to 60-40 consumer to enterprise.
Mhm.
I expect, though, that our enterprise business, which is growing, very fast, so 50% plus growth on the B2B side, that will ultimately be the lion's share of the business. The
Okay.
consumer business is a valuable component, but I expect that to be an engagement generator. I expect it to be a destigmatizing agent. I expect it to be a sort of a flywheel builder, not the actual driver of the business in the long run.
I don't think I've seen it as a destigmatizing agent, but I definitely agree. I think that's a great point. I think the stronger the consumer brand, I think it's more likely that you can face stigma quite more easily than probably if you're not a consumer brand. So
Which is super important in mental health. Not
Yeah.
every industry needs that. Mental health, despite good progress in certain populations, the stigma is still quite real. And we think it's important that you continue to focus on that.
And I think in the flywheel, you also talked about when it comes to B2B, talk about employers, right? Like, yes, winning the account with the employers is great, but you only get paid for number of employees that get activated. The stronger your consumer brand, the more likely more employees are going to tag along, and it's easier for you to activate these employees on your plans as well. So I think that consumer brand probably drives a lot of that, and it goes into the flywheel that you're talking about.
Yeah, and it depends on your business model, right? So we do get paid on a whole population basis when we work with enterprises. And today, we've got close to 4,000 enterprises that we're supporting today. But you certainly don't get the renewal if employees aren't engaging, right? There's a direct correlation with utilization and renewal rate. So it is ultimately important, even if you're not getting paid per employee user, but for whole populations.
Okay. So how can firms grow when it comes to B2B? How can they grow with employer plans and support mental health for employees and members?
Yeah, I think super important, and this gets back in some ways to value-based models, which just incentivize this. But my belief is that the mental health system today is fundamentally unscalable. So, when we talk about 60% of those who are diagnosed, and right now, World Health Organization estimates about 1 billion people around the world have a diagnosed mental health condition, and 60% of them are not getting care, right? So you have about 600 million people that aren't getting access to care today. And if you look at why, there's stigma reasons.
Mm-hmm.
There's system reasons, not enough resources that are there are too expensive for most people. So there's a whole bunch of structural issues that's not going to get fixed in the current way the system operates. There's just not enough providers out there to deliver mental health care. There's some models where they talk about, well, we need to get PCPs trained up on behavioral health care. That will help a little, but like PCPs don't have time either, right, to spend the amount of time needed to support somebody's mental health. And so new models are needed. And so my contention is, as you're thinking about building a mental health company, you really have to be thinking about supply demand and how are you breaking the current model, right? So how are you delivering far more care than the current units of supply can deliver? How are you using technology? How are you using step care? How are you using, everything at your disposal to try to innovate and build scalable models? That then allows you to support the health plans and the employers of the world in a much more cost-effective way, ultimately. And our belief is in a fully value-based way eventually. Okay,
that's interesting. So when it comes, one last thing about selling to employers, probably, I think it's definitely attractive. One reason, faster sales cycle, definitely probably better sales cycle than pharma, to selling to health systems and insurance plans. And employers, I think, also have more willingness to try less proven solutions if there is a possible ROI that they can get and add these benefits on to their employees. So I think it's a safer option, probably, in sort of long drawn out pilots when it comes to like partnerships with pharma. Do you agree? Your take or thoughts on that?
I do agree to an extent, and I would say from an employer point of view, there's so many solutions they're getting bombarded with
Okay.
that you need to know that you're in the top, 3 to 5 focus areas for a company. So
Okay.
if your solution isn't in the top 3 to 5 things that a benefits buyer is thinking about, there's just no chance of selling into that company because they have so much to focus on. That's particularly true as we head into this cycle here of, recessionary pressure
Okay.
and inflationary pressure, because they're going to have less budget and that budget's going to be harder to access. And so they're going to be more and more focused on the top things they need. Now, if you are one of those top 3 to 5 things they care about, then absolutely employers are a great way to build proof points, a great way to have faster sales cycles than pharma. But if you're not, I would say, focusing in on the larger plans or pharma or provider space where the incentives are aligned. They're either looking for cost savings or they're looking for access drivers, maybe a faster way to market over the coming couple of years.
And when it comes to employers, I think we touched upon this a little bit earlier, but one of the challenges continues to be activating employees once you sign on with the employer. That probably is less of a challenge for Headspace being a consumer brand and having that presence and understanding. For those that they don't have that consumer presence, any advice on how do they activate employees and things they need to do?
Yeah, so important. So Ginger, before the merger, lived this problem, and we had to build an entire we called it life cycle marketing team. And we had annual playbooks that we would build for our clients. We had multimedia approaches to reaching the end user. And it was all about creating those touch points at the right moments in time to engage those users. Once we engaged the users and the members and the employees, it was very successful. But, just as an example, if Headspace, because of the brand, is able to sign up 30% of an enterprise, almost immediately, Ginger had to work super hard to get to 10 to 15%. And in a lot of ways, 10 to 15% was already pretty good compared to the traditional, EAP offering that's in the sub 5% range. So it takes a lot of work. And again, as a startup selling to enterprise and to health plans, by the way, you need to be thinking about marketing. You can't just assume you have a contract, they'll come. You have to think about then how are you going to reach them? There's almost 2 sales, right? There's the initial sale to get access to the member, and then there's the second sale to convince the member to engage.
That's great. Okay, so jumping a little bit into geographies. I know for Headspace, millions of users. I think we read more than 190 countries. With presence in so many geographies, any lessons on solutions growing beyond one geography into vast multiple geographies?
Yeah, a few important lessons. I mean, one is so we are supporting people in 190 countries, but we have a few priority key focus markets that we're really, we have people in and we're spending time on, and that's, the UK, it's Germany, it's Australia, and a couple of others. And it's really important that you're committed when you go into a new market. Every market's a little different. Some are quite different. The health systems work differently in each market. The regulatory environment's different. And, it's usually folly to assume that just opening up a new market is going to work, right? So do it thoughtfully. I recommend, really understanding your core market before expanding, and, be thoughtful about the investment that you need to make to be successful in a new market.
Thanks, Russell. On pricing then, how do you price a mental health product? Is it based on complexity of the underlying condition, based on how and when the mental health intervention is needed within the condition? What goes into pricing, and any advice there?
Well, again, this, I mean, we could spend a week on this, right? I would say, a few pieces of advice. First of all is obviously understand your unit economic model and what does it cost you to deliver the care, and
Okay.
be thoughtful about how do you deliver the outcomes at less cost, right? So what are you doing to drive over time the cost out of that unit economic model as much as possible? Then once you understand that, that gets you into a point where you can start to think about, okay, how am I going to price this? I like to put things on a price value curve. So, what am I ultimately charging for this, and what is the value I'm delivering, or the perceived value I'm delivering, and where else are other options sitting on that price value curve, right? So as I think about potential competitors, or I think about who else is out there that could be a solution for this problem, where are they sitting on the price value curve? And just plotting that out will help you be thoughtful about, what can I charge for this, right? What is the value that's going to be perceived? And then the final piece is how value-based can I be, right?
Okay.
Ideally, you're building business models from the start that are value-based, that are, delivering as much, you're taking as much risk as you can on the delivery of that service. Because again, that's just going to make distribution that much easier if you can, from the start, be willing to take that risk on delivering the value of the service. You can often get more economics because you're getting a risk premium by pricing it in a value-based model, but you really have to understand your unit economics, and you have to understand your outcomes in order to be there.
Okay, unit economics and outcomes. I think that's good takeaway. Okay, one last question from my end, and then we can do audience Q&A. So please do add in your questions to the Q&A. So there's a ton of applications digitizing CBT. If that is the only approach, is there a key value proposition then based on customization, personalization? Any thoughts?
Yeah, certainly. I mean, some of you may have seen, we recently acquired a company called Shine, the Shine app, which is, very focused on underrepresented populations, populations that historically haven't been able to receive mental health care or content that was focused on their specific needs, as a Black person, or as a Hispanic person, or what have you. And that is, particularly in mental health, extremely important. That therapeutic alliance, that trust is really important to outcomes. And so I believe that, the CCBT model, which we know, I mean, our estimate is that, 30% of the people that we escalate from coaching to therapy could get value from CCBT, right? So, could reduce the in-person need. But the CCBT isn't always personalized to that person. So the more personalized it can be, the more they can feel this has been built for them and understands their lived experience, the more effective it's going to be.
Okay, thank you so much, Russell. So I have quite a few questions from the audience across our platform, so I'm going to quickly jump into them. So the first one, in behavioral health, traditionally we're told not to have hard numbers. Can you elaborate what outcomes we should focus on?
Yeah. I mean, I don't know about the don't focus on hard numbers. I mean, my experience is that there are a lot of really important measures in mental health that you can be using and gathering and applying to personalized care, value-based outcomes, right? And ranging from the more, call it rudimentary, which the PHQ and GAD, and using those measures either partial or full symptom response. So we're either reducing the PHQ number from 30% down for a partial response, or at least 50% down for a full response. You can use that as a measure. We are using things like 5-star ratings, so self-reviewed. How am I doing? We're using things like pre and post mood checks. We're using things like resilience scores. So we use CD risk, the WHO-5, PSS. There are a lot of very validated ways to measure that you can apply to both how are people doing, and then use that for value-based models.
Okay, the next question is quite interesting. So a famous mental health application sponsored CNN's live coverage of the US 2020 presidential election. Every time they presented a key race alert, CNN displayed the ad alongside it. Is that a good D2C strategy, or does it take away from the value proposition of treatment for anxiety, which has only recently started gaining attention in terms of wanting to solve for and getting away from stigma?
So just to make sure, and is that question in the chat, or is that?
No, we have across the platform, so we're collecting and then we're sending it across.
Okay, got it. So the first part of that question was, there was a famous
mental health application sponsored CNN's live coverage of US 2020 presidential election.
Sorry, got it.
So I think every time they presented a key race alert, CNN displayed the logo alongside the race alert for promoting anxiety. So the question is, does it take away from the value proposition, given that we're only starting seeing focus on mental health and stigma being taken away? So
yeah, got it. Yeah. So a few thoughts there, right? One is, I think that broad-based awareness of these things can't hurt. So I'm very supportive of bringing these kinds of solutions into popular understanding, vernacular, right? If we can talk about it, we can get people in earlier, and we can get them thinking about their mental health. So I'm supportive of that. I think that what's happened over the last couple of years in some areas has been concerning from the standpoint of, people and companies have been a little bit too aggressive in terms of, following sort of regulatory environments, which are there for a reason. Prescription of controlled substances, which are controlled for a reason. And so I think you have to be careful in mental health that we're doing things the right way. But generally speaking, I think awareness is a good thing.
That's great. Do you plan to move into prescription DTX?
I would say that not in the near term, but it's something we're evaluating. We are building CCBT capabilities, but I think that pathway is a little bit longer, and it's probably something that is a few years out.
In retrospect, single biggest thing you would have done differently in Ginger or Headspace?
Yeah, in the merger specifically?
No, the question is just anything that you would have done differently, probably as you started Ginger or now with Headspace.
Yeah, that's a good question. Some of the advice I gave earlier, just in terms of assuming a much longer pathway to revenue for some of these large partnerships, would have been one big one. Just knowing how long these things take and setting expectations about how long they take, because when you build a business, if you make an assumption about what kind of either revenue you're going to have, and so you build up a care team or a capacity to deliver that, but then that doesn't come, it creates some swirl, right? It creates some internal just complexity. And so, I would say that that's probably the biggest thing.
Yeah, I think that's fair. Do you have any plans to focus on clinical care? Where are you looking that is specific disease states?
Say it one more time, specific.
Do you have plans to focus on clinical care? Where are you looking, especially specific disease areas?
Oh, got it. Oh, yeah. I mean, we are, we have a very sizable clinical workforce today, probably in excess of full-time 500 clinicians, between coaches, therapists, psychiatrists. So we have a large care team, and it'll continue to grow. Now, we are, our model, if you look at the core differentiation that we see at Headspace Health, one is our brand and these consumer products that allow us to drive people in earlier. Two is this step care model. So a fully scaled care team that we can step up and down depending on the person's need. And then finally, technology to create efficiency and personalization in that model, right? Make sure people are at the right place, make sure they're getting scaled and cost-effective care. We do believe that over time we will add condition states within behavioral health. So we don't see ourselves expanding into diabetes care or MSK, but we do expect to expand into different areas. One example is we've recently expanded into adolescent care. We see ourselves at some point expanding into, we do mild to moderate SUD or substance use disorder support today. I see us getting into more acute support there over time. So I think there'll be areas like that we'll expand into just to continue to grow the comprehensiveness of the platform.
Okay. There's a question on what should we be paying attention to what's next in terms of either tech innovation in the field or psychedelics, what VR, CCBT, bots, etc.
Yeah, I mean, I think there's all kinds of super interesting opportunities here. We today are already using quite a bit of AI to create more efficiency in the care delivery models. So as an example, we automatically summarize a coach's notes using AI, so that they don't have to spend 10 minutes at the end of every session writing their own notes up. They're already there and they can scan and submit them. We already predict what someone's going to respond with and suggest those responses based on the responses of the top rated clinicians. Okay. So we're using AI to find the most high quality responses and make predictions about where they should be used. It's still in the hands of our providers, so it's still a live person. But over time, as confidence intervals go up, you'll see us start to, in a transparent way, but start to be able to communicate directly with our members without even needing a clinician in certain cases, right? So you can almost think of it as adding a bot to the care team.
Okay.
So you'll have sort of a bot level of support. You have your coaching, therapy, psychiatry. It becomes part of the step care model. And I see that coming in the not too distant future based on, progress we've made so far.
On similar lines, I think there's a comment or question rather on there is more discussion around peer-to-peer support in mental health. What's your take on peers who have experienced the issue helping others who are suffering?
Clear area of potential. And we've, you see some models out there that have been successful with peer support. It's been used in things like, substance use disorder and alcohol use disorder for forever, very successfully. The key there is effective oversight and moderation, right? You have to make sure that these models are structured in a way that somebody who needs a next level of care is getting it right, because peer support can be wildly effective, but if somebody's not appropriate for it, it can be harmful. And that person, if they're not recognized as needing the next level of care, can run into some serious potential risk areas. So, a very, very important area of research to solve supply-demand imbalance and to help scale care. But it requires, I think, a level of investment to ensure that it's being done the right way.
Thank you. So the next question, when working with health plans and providers, do you help them to identify candidate patients for your therapy? Example, specifying criteria that they can use to identify candidates? And if so, can you elaborate on this? Any other ways we can help identify patients?
Yeah, we use, like I mentioned before, some of the same measures we might be using to determine that somebody's getting better or not getting better. We use upfront to determine what's the appropriate level of care for this person. And so one example is in Blue Shield of California right now. Someone comes into this experience, and the first thing they're doing is taking a simple mental health survey. And based on the results of that survey, we may point them to Headspace.
Mhm.
We may point them to Ginger for coaching or therapy, or we may point them to in-person resources. So,
Okay.
What we're trying to do is as early as possible start to segment the audience, into the right level of care. Now, eventually, we want to be able to predict that, right? So, eventually, we want to be able to do much more active prediction, based on different signals that we know are predictive in terms of what level of care people need.
I think in the chat there is someone that's a disordered eating specialist. And the question is, how do specialist services and programs that usually require at least some personalized support fit into the digital model, hard to reduce costs right down without compromising care? I think you touched upon this a little bit, but I think, yeah, happy to take that question if you are.
Yeah, sounds good. Yeah, I mean, look, there are always going to be chronic patients. There are always going to be needs that are more difficult to manage.
Mhm.
And so I think there are two ways to think about this as a business, right? One is, you actually are upfront disqualifying yourself for that support, right? So in other words, if you, for example, in the case of eating disorders and similar things, there's often the case that you really want nutritional monitoring in place, really want some inpatient support in certain situations. And so, in our case, if we say we're not going to support that, we will disqualify ourselves up front and say we're not appropriate for that care.
Okay.
And we'll point to resources that person, could get value from. So do either a warm handoff or point to whatever resource the enterprise might provide for that. In other cases, you might, as a business, say, well, I know that the support for this is going to be more expensive, and my value-based model is not going to be profitable on those members, but I'm going to take them anyway, because I'm just going to look at it as a overall margin, not as an individual margin, right?
Yeah.
I'm going to assume that a sub X% of my patients are going to be chronic and are going to need that higher level of care. And I'll take the hit on that to be able to be a comprehensive provider.
Okay.
Right. And I think both models are legitimate. And I think the most important thing is that you are upfront about, both strategically as well as with your partner, here's how we're going to handle that. in our case, just as an example, Headspace Health, we disqualify ourselves for a lot of eating disorder kind of conditions because we don't believe we have the right resource to be able to handle it effectively.
That's great. This is an interesting one. Headspace has done a phenomenal job in marketing, from content online to your show on Netflix. Any recommendations for someone with not very huge budgets on how to prioritize and invest in marketing?
Yeah, I mean, the first thing I would do is say, really be thoughtful about segmenting your audience. So who is your core audience that you're trying to reach? The more you can be specific, the better then your strategies, both narrative, language, approach, distribution will be effective to reach that core audience. And the less funding you have, the more specific and focused you want to be in reaching that audience. Once you've really defined that, and I mean as tightly as possible, right? Then determining where those people are hanging out and how do you in a most targeted way get in front of those specific people. That to me is how you really you take budget and it make it as effective as it can be.
For me, I think personally, Headspace as a brand, Andy's voice is so influential that I think it's something that I can never walk away from. I love absolutely the way it is done on Headspace.
Me too.
Okay, so I think a couple more questions before we wrap up, Russell. In the Eastern world, mental health still carries a lot of stigma. Does Headspace do anything differently to scale in these countries? I think you mentioned that the geographies that you mentioned in priority are not so many Eastern geographies, but I'm happy to hear your thoughts.
Yeah, we've done a good amount of work in India. Have not spent that much time in some of the other Eastern countries, and we've seen a significant amount of interest. The trick with some of these areas is that the willingness to pay is quite different.
Okay.
And so, in a lot of countries where there's less capital availability, there's a lot of free options. It may be harder to build a scaled consumer product in those areas, and B2B is a more effective model.
Okay. I think within those lines, there are so many mental health apps in English, and it's not a native language in many countries. How do you navigate language barriers as you scale? Can English help you scale enough?
Really important to think about as you're scaling and as you're going into new markets that you can support the native language. We have focused on English from a care model standpoint to date. We've recently launched Spanish as well. French will be next. And so we are slowly investing in those, and then we're thoughtful about what markets are we spending our effort in based on language and ability to be successful there. On the Headspace side, we have 5 core languages today, and that has given us some pretty good coverage around the world, though we're always investing in it.
Thank you. So I think one last question on the acquisition of Shine. Can you talk about the need for diversity and how niche players can probably add value?
Yeah, I mean, we talked about it earlier. It's just so critical in mental health, and really in all of healthcare, right? This is part of the social determinants of health. That care is inclusive, that you can build these trusted alliances, that there's lived experience on both sides that is relatable. And so I absolutely think there are opportunities to build focused care models. The thing I would say is just be careful about, first of all, the TAM, and then second of all, the business model, because as I mentioned earlier, it's hard for a company to bring a solution in for only a subset of their population. So if you're selling into the enterprise and you're selling a a subset solution, you have to be careful that the TAM is big enough, right? That there are enough companies that'll invest in that.
Mhm.
One area that's been very successful is women's health,
Okay,
but women represent, give or take, 50% of an enterprise population, right? And so that's a huge audience. If you're dealing with an audience that's sub 20, sub 10% of an enterprise, it can get tricky to convince an enterprise to invest in that, because they have to think equitably, they have to think scalably, they have to think globally. So you just have to be thoughtful about your business model as you're building those kinds of solutions.
thank you so much, Rahul. There are a few more questions, but I think I'll respond to them separately based on the answers, because I think you've covered a lot of the topics that are in the questions. Personally, I think the hour went by quite fast. I don't know about you, but thank you so much for all the insights. This was quite an insightful conversation.
Enjoyed it. Great questions. Appreciate the time and focus on this topic, and we'll look forward to the next one.
Thank you so much, Russell. Thank you so much,
Thank you
everyone, for
both.
joining.
Take care.